Hi, my name is Dr. Parcells. I'm an orthopedic surgeon that specializes in hip and knee surgeries. I'm a surgeon with Seaview Orthopaedics, and we're located throughout central New Jersey. In today's conversation, I want to talk about hip bursitis or trochanteric bursitis. This is a really common issue in people, typically people over the age of 40. It's something I see every day in my office, and I thought it would be nice just to kind of chat quickly about what causes this condition, and then also what we do typically to treat it. So when patients come into my office with hip pain, one of my first questions is, where exactly does your hip hurt? And this helps me differentiate between soft tissue related hip pain and arthritic related hip pain. So when people have really bad arthritis in their hips, they usually feel it in their groin. And if we look at this model skeleton here, it'll kind of help explain why. The hip is a ball and socket joint, okay, where your femur bone or your leg bone connects with the pelvis. And the hip joint itself is actually contained deeper inside our body. And so usually it causes groin pain. Now, oftentimes people have hip pain, but they feel it on the side of their hip. And that really corresponds to pain over this bony prominence that you can see here. The name of this bony prominence is the greater trochanter. If you press on the side of your hip, you can quickly feel that prominence there. There is something called a bursa, or a little cushion that sits on top of this bony prominence, kind of helps pad it so it doesn't get too inflamed or overstressed. But what can happen over time is if you have chronic tightness of the muscles that travel across this area, you can generate inflammation in that bursa, or that little soft tissue sac. People feel it when they're rising from a seated position. A lot of times people can't get comfortable at nighttime because every time they lie on their side, it puts pressure right there and it causes a lot of pain. The good news about this is that it is not a condition that ever requires surgery. It can be sometimes very stubborn to get rid of this inflammation because, like I said, it usually results from having tendons that are too tight, in particular the IT band or the butt muscles called the gluteal muscles, which attach onto the greater trochanter. The best treatment is to do physical therapy in order to stretch out that area, to bring new blood flow into that area, and to wash out the inflammation. However, a lot of times people come into the office once the pain is already too much, like it's a 10 out of 10. And they really need some more short-term relief as they work on the long-term solution, which is improved flexibility. The quick fix for this is a cortisone injection, where we place a needle using an ultrasound machine directly around this area, and we inject cortisone and a little bit of lidocaine to reduce the inflammation. This works incredibly well, but it's also important to realize that it's just washing out inflammation, but not taking care of the underlying cause. So it's a great supplement to also doing therapy and stretching in order to relieve this issue.